Okay, so here's the key paragraph. This is why I made this talk, because this paragraph is so extraordinary. You don't usually see this extraordinary and clear of a paragraph in scientific journals. It says, a natural history of diabetes, both type 1 and type 2, begins with an initially long, clinically silent period. The patients remain normal albuminuric, meaning they don't leak protein into their urine typically, and they can initially maintain a normal GFR. However, here's the key phrase, however, during this clinically silent phase, structural lesions develop, including glomerular basement membrane thickening, GBM thickening, mesangial expansion, that's the connective soft tissue between the capillaries of the glomerulus, and glomerular sclerosis, fibrosis of the glomerulus, the filtration system of the kidney, meaning you're going into kidney failure. Once microalbuminuria is clinically apparent, the structural lesions are often quite advanced. So what they're saying is, by the time you can detect that there's a problem in the kidney, you already often have rather severe kidney damage. And then GFR decline, glomerular filtration decline, the ability of the kidney to filter, may proceed rapidly towards end-stage renal failure, ESRD. Indeed, treatment initiated after the onset of overt diabetic nephropathy, it typically cannot arrest progression. That's what I meant by you better pay attention to early warning lights, because otherwise you're going to end up screwed with the engine on fire, and it might not be so easy to fix. And that's what I meant by also dead man walking. I see all these patients like every day, and it's like, oh, my diabetes is under control, my hypertension is under control, you know, they're on all these different pills, and they're usually really not under good control, and they're progressing towards irreversible disease. And by the way, there is such a thing as a low or even a very low protein diet, sometimes requiring, well, I'm not going to go into the details of essential amino acids and not, but by dramatically lowering the protein of the diet and switching to a plant-based diet, so you decrease the acid load, you increase the vasodilators in there, the potassium, the magnesium, and the plant nitrates, you can improve blood flow to the kidney and decrease its workload, and you might be able to slow down kidney failure. Most doctors don't know that. Even the most kidney doctors don't know that.